And we know that induction has a whole lot of extra risks for the baby of not enough oxygen. That's why women who are induced or given synthetic oxytocin at least are monitored. If you're offered an intervention that requires monitoring, there's a risk to your baby, right? By definition. So there's extra risks to the baby and for the mother. We did a systematic review of this, of oxytocin levels in women with synthetic oxytocin. And what we found was kind of a bit different to what we thought. Like, because we were talking about the number of oxytocin receptors, making the woman's uterus so sensitive to oxytocin at the onset of labor or even in late pregnancy, you can't actually give a pregnant woman very much synthetic oxytocin because of that sensitivity. You'd cause too strong contractions that would endanger her baby. So compared to what you can give someone outside labor and birth, what you can give someone inside labor and birth is much, much lower. Like, for example, when they do studies in adults of oxytocin, they'll give like 40 units, 80 units. Like in labor, the whole labor, you wouldn't often give more than 2 or 3 or 5 units. So much, much more sensitive.
Welcome to the Birth Agni podcast, the fire that births us and transforms us. This is a space where women reclaim birth on their own terms, where deep ancient knowing meets primal courage. We talk birth, womanhood, breastfeeding, parenting, and the quiet power of choosing differently. Choosing of our own. Come as you are, leave more rooted. I'm Divya Kapoor, a childbirth educator, lactation counselor, trainee traditional midwife, and doula, disintegrating the politics of birth, one story at a time. Today we have a very special guest, very warm, loving, and kind, Dr. Sara Buckley. Dr. Sara Buckley has been a family physician, a researcher who birthed her 4 children in the comfort of her home. She's someone whose books I studied in my preparation to certify as a childbirth educator. The decades of her work has since 1997 reshaped how we think of pregnancy, birth, and early parenting, our connection with our bodies, and informed choices. As a researcher at the University of Queensland, currently doing her PhD on oxytocin, her work on the hormonal physiology of labor and birth has already made its mark through various leading publications, newspapers, media publications, midwifery publications, etc. She's the author of various books, including Gentle Birth, Gentle Mothering, and the landmark report called Hormonal Physiology of Childbearing, described as one of the most influential publications in maternity care. She has been featured in documentaries such as Orgasmic Birth, Birth Time, and Born at Home. In this episode, she takes us through the majestic oxytocin, the hormone of love, touch, a kind word, orgasm, oxytocin, and its role through pregnancy, labor, birth, and breastfeeding. We talk about this today. We touch upon various ways this hormone impacts the way we feel and give birth or breastfeed, and also how interventions then play out in the delicate hormonal balance of our bodies. And before we begin, if you've been following us as a regular listener and this podcast has helped you, please rate your experience with us on Spotify or Apple Podcasts. Every rating and review helps us get discovered by more and more families looking for genuine and authentic information on birth and informed choices. Let's get started now. Hi, Dr. Sara. Welcome to the podcast. I'm extremely thrilled to be sitting here talking to you, and I've had a good time speaking with you, pre-briefing this conversation. And it's, I feel very connected and comfortable talking to you about everything, and you've made that space for me, and I'm so grateful to you to do that, and I'm so thankful for that. So thank you for being here.
It's a pleasure, Divya, and thank you for giving me the opportunity to chat to you and to expectant families in India as well. It's really a privilege. I think I was
Yeah.
telling you I spent some time in India when I was in my medical training in the south of India, so I have a special place in my heart for India.
Yeah, you told me how you went from all the way south to all the way north and you saw the different foods and the culture. It was so fascinating to hear all the stories. Yeah. So, Dr. Sara, pregnancy. I remember my daughter's time, Divi. I used to feel that I was elevated. I was in a different plane. Nothing really bothered me except a few very poignant, very specific things. I knew, okay, this is what is bothering me. A lot of clarity was there in pregnancy. um, so you've been doing a lot of research and all your work around oxytocin now, um, and the pregnancy hormones. How do you think pregnancy and the oxytocin is related, or pregnancy in general and the hormones? How does that change the woman and how she feels and behaves? And yeah.
So pregnancy is a big time, growing another human in the case of women, but really a lot of the things that I'm talking about apply to all mammals because mammals, we have mammary glands, we suckle our young, and specifically we're placental mammals, which means that we give birth to large live young, as opposed to in Australia, marsupial mammals who have a different method of giving birth. So we're giving birth to these large live young, they're in our bodies for the whole of pregnancy. And what we know from a lot of research in humans and animals actually too is that the state of the mother in pregnancy is very important. So if the mother is very stressed in pregnancy, it's basically giving the baby the signal that they're coming into a stressful environment and they better amp up their stress responsiveness. Yeah. So stress in pregnancy is a good thing if you live under attack or in a stressful or low resource setting from animal perspective. But it's not so good for generally for human babies because it creates more stress responsiveness. So Mother Nature kind of knows that and builds into pregnancy a whole lot of systems that reduce our stress responsiveness, which is what you're describing. So often in pregnancy, when we're describing feeling more calm, less reactive to stress, and there's a whole lot of things happening. But my particular interest is oxytocin. That's what I've been writing on for my PhD. So I'll talk about it from oxytocin perspective. So as pregnancy advances, and this was actually what we call a systematic review that we did. So we took all the studies that had been done that had measured oxytocin levels in pregnancy and in labor and birth. And when we put all those studies together, we found that, in fact, in pregnancy, oxytocin levels do gradually increase. So oxytocin, I'll just describe what it is. It's a hormone, so it's released in one part of the body, has its effects in another part. So fast tocin birth. So it was first discovered as the hormone that makes birth go fast, and it certainly does that. And people listening may have heard of oxytocin being given in labor to make birth go fast. That's a synthetic and artificial form of oxytocin. But our own oxytocin is actually made in our brains and it's released into the body. And that's where it finds the receptors. We'll talk about receptors in a minute in the uterus, and that's what causes birth to go fast. But at the same time as it's being released into the body, it's also being released into the brain, especially during labor, but also in pregnancy. And it has widespread effects in the brain. You may have heard of oxytocin being called the hormone of love, hormone of calm and connection, hormone of monogamy, hormone of trust, the shy hormone, a lot of effects in the brain. But one of the major effects it has is it reduces the stress system. So reduces the adrenaline, the kind of fight or flight system, the, oh my God, but it also reduces the release of cortisol, which is the long-term stress system, which is what we release when we're kind of under, stress for hours or days or months. So both of those stress systems are reduced by oxytocin, and oxytocin shifts the whole hormonal balance of what we call the autonomic nervous system. And I'll just explain what that is. So it's kind of like the automatic nervous system. So it's the part of our nervous system that's always controlling the parts of our body we don't have to think about, like our blood flow to our skin, like our heart rate, like our blood pressure, in fact, the way that our gut's working as well. So when oxytocin is released in the brain, it increases what we call call the parasympathetic branch of the autonomic nervous system, and that's what has those calming effects. So it slows our heart rate, reduces our blood pressure. In fact, it increases the effectiveness of our digestive system. And you can imagine that's really useful in pregnancy when you're eating for two, right? Not only are you eating more, but your digestive system is actually working more effectively because of the oxytocin effects in the gut. So the parasympathetic nervous system goes up under the influence of oxytocin, and the sympathetic, the fight or flight, we're less kind of stress reactive in that short term fight or flight way, but we're also less stress reactive in that longer term cortisol way. So oxytocin has all of these effects. And another important function it has in pregnancy or starting in pregnancy, but particularly in labor and birth in the brain, is it switches on what we call the reward systems of the brain. So the dopamine areas of the brain that make us feel good, that reward us. And in labor, we get these massive increases in oxytocin in the brain, plus oxytocin receptors. I'll just come back to that in a minute. But what that means is that these large amounts of oxytocin in the brain switch on those reward centers, so that when the mother, and I'm talking about all mammalian mothers here, meets her babies for the first time, those babies are immediately a source of reward and pleasure for her. And she gets the sensory stimulus of the babies, the sight of the babies, the smell, the taste. Most mammals lick their babies, the touch of the babies, and that becomes, we say, fired and wired, like connected up in her brain with those reward centers. So from the beginning, the babies are a source of pleasure and reward. And that's why any mammalian mother looks after her baby, right? They don't go to classes to tell them how to take care of their babies. It has to happen from birth. And that's the way that we say central oxytocin, that means oxytocin in the brain, ensures basically the survival of the species, right? Because if the mother wasn't rewarded and motivated to take care of the babies wouldn't survive. And that, well, we haven't sampled the brain in actual real live women, but we can presume from other things that we know that this actually happens in women as well. So that whole system of, reward and pleasure, calm and connection, bonding to the babies is gradually increasing as pregnancy progresses. And as I said, it's physiologically slowing the heart rate, helping the body to adjust actually to those extra blood volumes that you get in pregnancy. It has a whole lot of benefits there. And I'm just going to say one more thing, because I've mentioned this term oxytocin receptor. So a receptor, so a hormone, as I described it, a substance produced in one part of the body with effects at another part, works by binding to a hormone receptor. And I say it's like a key and a lock. So oxytocin's the key. The hormone, the oxytocin receptor, is the lock. And some hormones, there's several keys that can fit that lock, or several locks that the key fits. But oxytocin is, we could say, monogamous. There's one key and one lock as far as we know. So for oxytocin to work, it's released, well, we'll say in the uterus, it's released from the brain, travels to the uterus. It finds the receptors, which are on the outside of the uterine muscle cells. So uterus has a muscle, that's how it contracts. It binds to those receptors, and it's like turning a key into a lock. It sends a chemical message into the cell saying contract. So that's how oxytocin causes contractions in labor. And with all these hormonal systems, it's not just how much oxytocin is around, and we can measure that in the bloodstream, right, with oxytocin. It's also how many receptors there are, because the more receptors, the more sensitive that tissue is going to be to oxytocin. And that actually happens in the uterus. We get this increase, this massive increase actually, in several hundred times more oxytocin receptors in the uterus at the start of labor. So the uterus is very sensitive to oxytocin. And that was one of our findings actually in our systematic review, that the woman's, and this is a human study in women, the women's oxytocin levels at the beginning of labor are not actually very high. But because she's got this increased number of receptors, she's got this increased sensitivity. And that's what contributes to, doesn't cause, we can talk about that, contributes to the onset of labor. So we talked about oxytocin receptors in the uterus, but as far as in other animals, we can sample oxytocin receptors in the brain, and we can say that those get increased as labor begins. Just those last hours, days before the onset of labor, there's an increase in oxytocin receptors in the brain. And that makes sense because it's got this big job to do, which is to activate the reward and pleasure centers and basically ensure survival of the species. So that's kind of how the body prepares and how oxytocin helps us in pregnancy. But there's other changes that happen in pregnancy. There's a hormone called prolactin, and there's prolactin-like substances that circulate in the body that kind of, I say, like help to soften the brain, and we become a bit more tender. And, my daughter's pregnant as well, and she was saying how kind of, tender she is with little puppies and babies and ducklings and things like that. So, yeah, it helps us to kind of get ready and also, I guess, to kind of try out those tender feelings, but also to start to orient ourselves towards motherhoods because, labor and birth is not the onset of motherhood. Like motherhood begins, we could say 9 months beforehand. And Mother Nature knows that, we're getting all of that preparation up to the moment that we give birth.
Incredibly fascinating is what I would say. Incredibly fascinating. Often moms come up and they say, oh, my immunity is reduced in pregnancy, or maybe my system is not functioning at its best. And all the things that you just said, this kind of brings us to the fascinating aspect of how the body really takes care of us if we really are in tune with what its needs are. And the digestive system, that's something everybody thought was suppressed, and it's something that's working efficiently with very limited resources with respect to space and everything. So incredibly fascinating all of that is. And from here on, when you spoke about oxytocin and sort of the receptors and how the body goes into labor and all of this is so connected, also makes me feel that this explains the spiritual aspect of pregnancy and birth when you said that a baby will respond to the stress outside the environment and would know then that's safe for the baby to be born or not. So that kind of explains in a more logical sense for people who are more oriented to logic behind spirituality as well, that this is how Mother Nature designed it that way. The spiritual aspect is also there, that there has to be love, there has to be connection, there has to be talking to the baby and everything else to kind of have a very calming effect on the mother as well as on the baby. From here on, when we talk about due dates and oxytocin, how are they related? And then due date also is such a huge topic because here in India, we are not letting women go beyond 40 weeks. Even WHO says that 40 plus minus 2 weeks is normal. Even the Indian gynecological, the regulations, they say it's okay to take a case-to-case basis post 40 weeks, which is more individualized. But it's not happening. And with VBACs, women are even asked to start thinking of birth 38 weeks onwards. So yeah, what's the connection between oxytocin and due date, as well as do you think that we should really be after the due date?
Yes, good question. Well, the due date is obviously a mathematical calculation, and saying that every woman should go into labor on 40 weeks or 39 weeks, if you like, is a bit like saying every baby should walk at a year. I mean, it's just ludicrous to say to confine biological systems to mathematics because there's natural variation. We know that in humans, the natural variation of term labor is like 38 weeks to 42 weeks. Some women go longer, some women go shorter. And, the thing is that we've talked about oxytocin and the oxytocin receptor and the increase, or we say upregulation in the lead up to labor. Even late pregnancy to birth, there's still like about a 3 times increase in oxytocin receptors. So even those last few days, the body is still readying itself. And that's just the oxytocin system. Like there's so much more going on in the body of the mother and the body of the baby. And I've got to say that we don't actually know what causes the onset of labor in humans. We don't know what it is that makes labor start today and not yesterday. We know some of the preparations that happen. And basically what we understand is that it's the baby that initiates labor through passing chemical signals through the uterus that get the mother's body prepared. So the baby's readiness, the baby actually produces a substance called DHEA from the adrenal gland as it matures. And that goes to the placenta, and the mother uses that to make estrogen, and then estrogen upregulates her oxytocin system and gets her ready for labor, and a whole lot of other things too. There's a whole lot of other changes happening in parallel, mostly to do with that increase in estrogen. As I said, we don't know what actually causes the onset of labor in women, so it's rather arrogant, I would say, to kind of step over that and to say that this baby's ready to be born, because it's the baby that signals the readiness. So, we haven't really looked at that in a lot of detail, and if we say, if we induce, for example, every woman at 39 weeks, yes, some of those women might be ready for labor. They might have gone into labor tomorrow. Some of those women might be 3 weeks away, and that means their baby's 3 weeks away. And, one of the things that we are seeing is a lot more epidemiological studies looking at the gestation of the baby and longer term outcomes, developmental outcomes, school achievement outcomes. And basically, the longer the baby is in the womb, the better those outcomes are. So some of those brain maturation things are happening in the baby in those last few weeks of birth as well. The baby also has a whole lot of preparations for the processes of labor and birth. I mean, if you think about for the baby, it's just incredible. It's almost unbelievable, this transition that every mammalian baby makes from what I call hotel de womb, the baby in the womb, where everything's laid on for the baby. The baby gets oxygen through the placenta. The mother keeps the baby warm. She nourishes the baby. She gives the baby food. She takes the baby's waste away. All of those things are happening. And basically the baby's got room service. The baby can order what it needs from the mother by sending chemical signals to the placenta. And then suddenly at labor and birth, and in a moment, the baby's ejected from hotel of the womb, and baby has to do all those things itself. So that transition, and especially the respiratory transition, the breathing transition from never using the lungs in the womb and just a small amount of blood going to the lungs, to suddenly the baby's circulatory system has to rearrange itself so that 40% of the baby's output goes to the lungs and the baby can breathe oxygen, which it never has done. So that respiratory transition is obviously the most critical. And some of the preparation for the respiratory transition happens through, I don't want to go into too much detail, but what we call the catecholamine surge, which is a large output of adrenaline and noradrenaline that happens in labor. But the bit I do want to say is there's a whole lot of preparations, a whole lot of receptors that are upregulated for that process, so that the catecholamine surge, so that hormones can work effectively. So the baby, if a mother has a scheduled birth by pre-labor cesarean or induction, the baby's not at full readiness, the mother's not at full readiness, and sometimes labor just doesn't happen, right? We get a so-called failed induction, but that basically means the mother wasn't ready enough. We can try and force her to be ready, but we don't really understand some of those more subtle aspects, like what does it mean if the mother's brain doesn't have that full complement of oxytocin receptors? Will she still get that euphoria, that feeling of ecstasy when she gives birth to her baby? Will she bond with her baby in the same way? Will labor be more painful, for example? We haven't mentioned this, but oxytocin in the brain also has natural pain relieving properties as well as being calming. So would she miss out on some of those pain relieving properties, which actually become maximal at the onset of labor? There's a whole, you were talking about calm in pregnancy. Actually, the woman or the female mammal becomes less sensitive to pain. They have a natural pain relieving system that comes from the oxytocin system and affects the spinal pain processes. So that happens and again peaks in labor and birth. Mother Nature is giving us all this help to make labor and birth as smooth as possible. And we think about women, we can kind of imagine it's going to happen. We might have seen other people or at least read stories, but imagine a first time birthing cat that's never seen anyone in labor. Like, they could be totally freaked out, totally, scared, and that's going to stop their labor. So Mother Nature has all these processes to make sure that we're as calm and supported and have this natural pain relief as we go into labor. And that's true for women as well as for all our mammalian cousins. So yeah, stepping over that whole process of peak readiness, if the mother hasn't gone into labor, she's not at peak readiness and the baby isn't at peak readiness. And I really don't think we understand that well enough. I mean, we've come to a point, and some of the more recent studies, we used to say 37 weeks was term, 38 weeks was term, and now we know from studies that the much better outcomes are post 39 weeks, but that's not true for all women. most women won't have gone into labor at 39 weeks. And most women, some women won't have gone into labor at 40 weeks. And, especially first-time mothers that have a longer gestation. So I really think that from a hormonal perspective, we're really being quite arrogant to presume we know better than Mother Nature.
On induction here, we are often quick to tell women that, okay, you can have a normal birth. We can induce you. And, it's okay. We need to get the baby out. It's okay to get induced. We'll have gentle inductions. We'll start with gels and we'll try and moisten the cervix. And then we'll go from there, up from there. One method, second method, third method. Sometimes when we call inductions gentle, it kind of plays with the mind and makes it feel that it's not going to hamper the process. What do you think? How does it play with her natural state of going into labor or the labor, or how does it change the entire trajectory of labor itself?
Those are good questions. And to be honest, we don't have a huge amount of information about that. I mean, one of the things I say about induction, or we could say scheduled birth, which includes pre-labor cesarean, I say that the changes that happen in labor and birth is that the preparation for labor and birth is a bit like the preparation for a huge ceremony. So imagine a marriage ceremony. Imagine all the weeks, the months and weeks and days involved in preparing for that. And there's this peak readiness that the bride and the groom come together and their ceremony all happens. Well, imagine the bride and the groom coming together like a week beforehand and expecting everything to be the same, right? It wouldn't be, or a day beforehand, or even like an hour beforehand. There's not that peak of readiness. And induction of labor is like that similar thing. It's missing that peak of readiness. So we don't really understand all the implications of that. But what I can say about induction is that we're pushing the system. We're trying to make something happen that isn't ready to happen. Sometimes it doesn't work because the body really doesn't have that readiness. And again, if we said every woman was going to be induced at 39 weeks, yes, some women might be almost ready, but some women might be weeks away from their own natural readiness. So we don't know that individual woman how far away from peak readiness she is really. So that's one thing. The second thing is those processes of induction. Again, we don't really understand them. Is, for example, a prostaglandin induction, does it have the same hormonal flow as normal labor? Probably not. Some of the studies that we've looked at, this is not published data so far, but some of the studies we've looked at suggest that the woman may not get her whole oxytocin flow when she's induced with prostaglandins, for example. And when we've done this research, there weren't any studies on, other methods of induction like balloon catheters and those ones that soften the cervix. There's no research on that, what that might do to the hormones of labor and birth. And then, of course, eventually, probably, we're given these things, unless she's almost ready to go into labor, would have gone into labor probably within a day or two, she's going to have the second one, or as you say, maybe the third one, and that could be synthetic oxytocin. So we're going to have to push her uterus with this, make labor, make birth go fast oxytocin, and use that aspect of oxytocin. And the thing is with synthetic oxytocin, when we inject it into the body, it doesn't go back into the brain. So oxytocin is quite a simple molecule. It doesn't easily pass biological membranes. There's a specific mechanism by which it's released from the brain into the body, because obviously that's the way it's meant to work. But there's not a mechanism to make it go from the body back into the brain. About 1,000th of it passes back into the brain. So it's not enough to give those calming, connecting effects when you get it injected into the body. So the laboring person gets that increased stress and pain of labor, that increased contraction strength, the contractions are closer together as well. So they're not getting that break in between. The baby isn't getting that break in between. And we know that induction has a whole lot of extra risks for the baby of not enough oxygen. That's why women who are induced or given synthetic oxytocin at least are monitored. If you're offered an intervention that requires monitoring, there's a risk to your baby, right? By definition. So there's extra risks to the baby and for the mother. We did a systematic review of this, of oxytocin levels in women with synthetic oxytocin. And what we found was kind of a bit different to what we thought. Like, because because we were talking about the number of oxytocin receptors, making the woman's uterus so sensitive to oxytocin at the onset of labor or even in late pregnancy, you can't actually give a pregnant woman very much synthetic oxytocin because of that sensitivity. You'd cause too strong contractions that would endanger her baby. So compared to what you can give someone outside labor and birth, what you can give someone inside labor and birth is much, much lower. Like, for example, when they do studies in adults of oxytocin, they'll give like 40 units, 80 units. Like in labor, the whole labor, you wouldn't often give more than 2 or 3 or 5 units. So much, much more sensitive. So that means that the levels of synthetic oxytocin in the blood are not very high. And by the way, synthetic oxytocin is the same molecule as oxytocin, so we can't differentiate them in the blood. So what we found, that levels aren't very high. It doesn't not high enough to cross to the baby, not high enough to cross to the brain and cause the kind of effects that people worry about, like autism, like depression. We don't think it causes that. But we think that the effects in the body, just that extra stress of labor. Labor's not designed to be more stressful than it needs to be to get the baby out right. And there's all this calming, anti-stress effects of oxytocin that synthetic oxytocin doesn't have. So we think that these longer, stronger contractions add that extra stress to the mother and could shift her system, and we can't prove this at the moment, from the kind of oxytocin anti-stress, like enjoying labor or at least some calmness and some natural pain relief, into a more stressed system, and it's not just like the emotional stress of more pain, it's also the physiological stress of those extra contractions of the uterus. And the uterine muscle can get tired, right? Just like if you run a long way and you're not used to running, your muscles get sore, and they build up lactic acid. And this is what happens in the uterine muscle too. It gets tired, it builds up lactic acid. We have to give more synthetic oxytocin to push it harder. And it's really increasing stress for the laboring mother. That is better avoided unless it's really necessary. Of course, there are times with all of these interventions when inductions is life-saving for mothers, life-saving for babies. And, it's great to have the experience of labor for the baby. It certainly is much better for the baby generally, for a healthy baby than a pre-labor cesarean, right? The baby has the processes of labor and birth, and that, as I mentioned, catecholamine surge that readies the baby for life outside the womb on lots of levels. So the baby that misses labor is kind of doubly, or with the pre-labor cesarean, is doubly affected because they're not ready for labor and birth. They're not ready for life outside the womb. They haven't had labor and birth. And, there's morbidities, we say, problems that pre-labor cesarean babies have. They often have, not often, but about 6% of babies have difficulty making that breathing transition. They're more likely to get cold. They don't have the activation of their own natural heat producing systems. They're more likely to have a low blood sugar. They don't have the activation of the metabolic systems that help them to make that transition to making their own metabolic fuel. So all that's true for pre-labor cesarean babies. Induction is, I think, having some experience of labor is better than that, but still there's a whole lot of gaps, we say hormonal gaps, that are happening, and some of which we don't really understand.
So even if it's gentle induction, it can still be detrimental to the mother and the baby when not needed.
Yeah, they're not at a full state of readiness is what I would say. And some of that we don't understand. And, women can describe after induction, especially with synthetic oxytocin, feeling just like a whirlwind. It's all happened too fast. It's been too strong. They couldn't keep up. And that's literally true. Their hormones couldn't keep up, because what happens in a natural labor, and I just want to describe this in some detail because it's really important. So in a natural labor, we get this, what I call snowball of labor. So if you've had a baby yourself, you know that labor starts off small like a snowball and becomes bigger and bigger, and in the end becomes virtually unstoppable. Right at the end of labor, you kind of wish you could stop it, but you can't. You're just rolling down that hill, right? Anyway, so the reason you get this snowball of labor is because labor has what's called positive feedback loops of the oxytocin system. So I'm just going to explain what that means. So you and I are sitting here. We're in this. There's a concept called homeostasis, and that keeps all of our physiology stable. So we're all sitting here. If there was suddenly a loud noise, we'd get a fright, would activate our adrenaline, our heart would go up, we'd get ready to run away. But then our body would go, oh, there's no threat. We can bring all those things down. So that's a negative feedback loop. Things are too high, we bring them down. We get back back into this flat line homeostasis, right? But labor is not a flat line, right? Labor is not homeostatic. Things don't stay the same in labor. So the labor is an accelerating process, the snowball of labor. Things become bigger and bigger. And this happens because of this positive feedback. So what happens in labor is that the contractions of labor, the sensations of the contractions, and especially the pressure of the baby's head or presenting part on the cervix, on the kind of the lower pelvis, sends a signal by a specific sensory nerve pathway to the brain. And when that information gets to the brain, it tells the brain to release more oxytocin. So the brain releases more oxytocin. It goes through the bloodstream to the uterus, finds those uterine muscle receptors on the uterine muscle cells, gives stronger contractions, more sensations, more signals to the brain, more oxytocin release, and we get this positive feedback loop. And that's what fuels the snowball of labor. And that is it's sometimes called the Ferguson reflex, that really helps the baby to be born quickly and efficiently, because when you get to that pushing stage, the sensations are quite strong, right? So you get this enormous feedback and helps us to birth our babies as quickly and easily. And some of these things, all of these things we could say, have evolved through like millions of years of evolution. And for all that time, we've given birth in the wild. So in the wild, any mammal giving birth is at risk, like she's behaving strange noises, strange smells, the blood, the amniotic fluid, very much at risk from predators. So it's important that her labor is as efficient as possible. And the pushing stage, particularly, she's very vulnerable in the pushing stage. So this oxytocin positive feedback loop or cycle, like the Ferguson reflex, is what makes labor as efficient as possible, because it makes sure that oxytocin is accelerating, the snowball's going as fast as it can, the baby's going to be born as quickly as it can. So the sensations are really important for the processes of labor and birth, and the readiness of the mother's body is really critical as well. But the other aspect of that, so I said that the sensations feed back to the brain and cause a release of more oxytocin, so more oxytocin going to the uterus, but also more oxytocin going to the brain. So this positive feedback means that as the contractions strengthen, we get more oxytocin release in the brain, we get more calming, more connecting, more natural pain relief, and it gradually builds up as the snowball gets bigger and bigger. So if a woman has an induced labor, we're kind of speeding all that up, and it's likely that she's not going to be able to keep up. Suddenly she's getting these strong contractions. She hasn't had that chance to build up her brain oxytocin to help her to deal with it. So it's kind of unkind, really, is one way of putting it, to really give a woman this kind of strong induced labor when she's not ready for it, when she's not physiologically ready for it. And of course, most women being induced need some form of pain relief because it's painful, right? And nowadays women are reaching for epidurals. Epidurals can be really beneficial when there's severe pain that the laboring person can't keep up with. But on the other hand, the problem with the epidural is that, remember I said it's the sensory feedback, it's sensations of labor that feed back and tell the brain to release more oxytocin. So when we have something that's so effective as epidurals that stops those sensations, basically it stops that positive feedback loop. And research that we've done, a systematic review, shows that oxytocin levels go down, or at least don't go up in the whole of labor when a woman has an epidural. So we've shut off that oxytocin positive feedback loop. She's not getting the natural calming, connecting, pain relieving. She's not getting the activation of the reward and pleasure centers when she has an epidural. So yeah, and it starts off the induction, we can say it's gentle, but it starts off that cascade of intervention. One intervention, we've overridden her own ability to cope, so she needs another method of pain relief, and then the epidural slows down the labor, and she could end up with like a forceps delivery and a vacuum delivery. She can't push her baby out because that positive feedback loop can't get going with the epidural, or she may even have a cesarean because epidurals can also, the drugs go straight into the mother's body, they go to the baby, they are designed to cross biological membranes, and the baby gets a dose of those drugs too, and it can impact the baby by other mechanisms through the mother, some of which we don't understand, may affect the mother's blood supply to the baby, it may affect the mother's hormones, but basically babies can have adverse reactions to epidurals as well. So we kind of start with one intervention, let's do a gentle induction, and we end up with, a cesarean or an instrumental birth, or at the very least, not the oxytocin levels that she would naturally have.
makes me feel that there are so many things that it can lead to. So I was thinking of when you said that there'll be no feedback loop, or it would be it wouldn't be as efficient as it would be in a spontaneous labor. So the uterine muscle might get so tired that it might lead to failure of progress, which is usually one of the common reasons. And the other is uterine rupture as well in rare cases. If we top it up with more and more synthetic oxytocin, and especially for VBAC mothers, thankfully in India, from the experiences of the mother that I've supported, I know that we are not inducing women who have a VBAC. We are actually just pushing them into surgery, not even a trial of labor. That's another sad aspect. But inductions is something that is not being done. But I am a part of groups across the world where inductions are being done for VBACs at 39 weeks. Those are gentle inductions, but sometimes I do read that, okay, there was an occasional uterine rupture, and many moms believe that that is a reason that VBACs should not be supported. And it's true that they shouldn't be supported. Instead of probably that it could be because of the non individualized care in terms of being induced.
Yes, definitely. I think that if there's a susceptibility in the uterus, you want to be very, very, very careful. You don't want to push the uterus and the mother, really, when she's got that vulnerability of a uterine scar from a previous cesarean. And I hope that around the world we are being more cautious. And it is good that when induction is needed, there are these other methods like prostaglandins, although they can also cause strong contractions. But balloon catheters that trying to get the mother's cervix in a state of readiness that it would naturally be. And yeah, some of these methods can be effective and are probably a good place to start if you do genuinely need an induction for the well-being of yourself or your baby. Yeah, and a lot of inductions are being done for post dates, and as we said, that's it's a, I would say, partial indication. It's not a definite indication for induction, and it's a conversation. It's a conversation between you and your baby and your caregivers. It's your choice. You always have the choice whether to accept what you're offered or not, and you can weigh up the risks and benefits of it. There is a small increase in stillbirth as you go past 40 weeks, but it's about 2 per 1,000, something like that, increased risk. And you've got to decide if that risk is material to you or more important than the kind of risks that we've been talking about, and the risk that the induction is not going to be a good experience for you or good experience for your baby. You could end up with that cascade of intervention. So, I think everything is about making informed choices, like knowing what the risks are and the full risks as well. Like, for example, people have probably been quoted the study called the ARRIVE trial, which supposedly, there's a lot of flaws in that trial. You can read the blog on my website about it, but supposedly showed that induction at 39 weeks reduced the risk of cesarean by a very small amount, very small. But anyway, maybe that's a true finding within this kind of narrow environment of a randomized controlled trial. But in the real world, inductions increase the risk of cesarean. So I think induction probably is more likely to increase the risk of cesarean for the reasons that we've stated. So, do your research, get the information, look at the choices that you're offered and make up your own mind. It would be my advice about induction of labor and anything in labor too. Yeah. And talk to your baby as well. Talk to your baby in your belly. I say that, your baby in your belly, it's not just hormonal signals and chemical things going across the placenta. You're the closest with each other than any humans could possibly be. Imagine being stuck onto your partner for 9 months. Imagine how intimate you'd get with each other. You'd kind of know each other from the inside out. You'd know each other's moods, and that's how it is for your baby. So I really believe we have these kind of channels of communication with our baby, that are, well, I think they're physical, they're probably hormonal in some way as well, but we have these, we could say, we could have these other ways of communicating with our babies, I could say. So, lie down in your bed, put your hands on your belly and talk to your baby about interventions that you're being offered as well. And if you do need these interventions, talk to your baby and tell them what's going to happen. I think there's a way that those communications get through, I believe.
Yes. And while you were talking about the inductions, the other two aspects that were coming to my mind was bleeding post-birth due to inductions. Is that possible? Or second is when the mother's body is not able to cope up with the induction, then is there a chance of birth trauma after? So we used to look at PTSD or postnatal depression as a normal aspect of giving birth, which we are seeing that more and more women who have an undisturbed or unmedicated birth realize that it's a different experience in and out, which you explained in the beginning as well. The painkillers, the high oxytocin, and the feeling of ecstasy after. So is it that interventions can, when not needed, when they're needed, of course they're needed, and that's when we are ready for it and we prepare ourselves for it. When they're not needed and when they're done as a protocol, do these things also kind of happen? Like, it can cause excessive bleeding if the uterus is too tired in the process, or postnatal depression or birth trauma. Yeah.
Yeah, okay, those are big questions. Well, the first one, the bleeding one, well, remember I said that the uterus is a muscle, and if we're giving synthetic oxytocin, we're working the muscle too hard, and the muscle build up lactic acid, and that makes it not function so well. And there certainly is, from studies, when women have synthetic oxytocin in labor, and probably the higher doses or the high total dose they have, the worse it is, but they are more at risk of bleeding after the birth. And we think it's probably because the uterine muscle is getting tired. There are some studies suggesting that at high doses of synthetic oxytocin for long periods of time may actually reduce the receptors, and that's possible as well. And we think if that happens, it's probably from all that overwork of the lactic acid and working on the receptors. We've got a long discussion about that in one of our papers. So yeah, that's definitely a thing. And then you've got to figure out how are you going to stop those women from bleeding after the birth. And often we have to give higher doses of synthetic oxytocin after the birth to stop bleeding. So there's other drugs being used as well, which is probably sometimes needed, right? Because yeah. Anyway, so that's the bleeding. So yes, definitely higher risk. In terms of PTSD and depression, well, certainly the more interventions you have, generally the worse the birth experience, and in the extreme, it can cause post-traumatic stress disorder. And kind of globally, from the studies I read, the incidence of post-traumatic stress disorder after childbirth is about 6%, which is actually higher than soldiers coming back from combat zones. And they did a survey in Brisbane, actually, where I live, in 2000. They surveyed women post-birth, and 30% of women had at least one symptom of post-traumatic stress disorder. And they're severe symptoms, right? Like panic attacks, like intrusive thoughts, like you can't go past the hospital, like that. They're severe symptoms. So, we're really not doing a good job of protecting women in labor and birth. And sometimes birth trauma is not even, generally it's not even so much what happens, it's how women were treated in labor and birth. Like, were they respected? Were their choices respected? Did they take part in the decision making? Did they feel like they made the decisions that were right for them? So those things are really important. Like, respectful maternity care is really the antidote to post-traumatic stress disorder. And I read a study recently in a midwifery journal where they interviewed the women and what had happened. And one comment they made, which was very interesting, they said the things that gave the women like birth trauma, that women said they had birth trauma, were things that the staff may have not even known, that would have been routine for the staff. So I think there's a culture in maternity care worldwide, really, of not respecting women in labor and birth, of kind of infantilizing or being paternalistic and not talking to us as actual adult women who are, able to make choices for ourselves. So I think respect is one of the keys to that. But it's interesting in some of the research that we did, because oxytocin actually is being used as a treatment for post-traumatic stress disorder. So I kind of wonder if women get that full complement of oxytocin in labor and birth, whether that would actually protect them. And oxytocin in studies, actually, the way I describe it, kind of softens the memory, right? So, and I think it's designed to do that in labor and birth, right? Like, it is an intense process for women, for any animal, right? And you don't want to remember the worst parts of it. Otherwise, you'd freak out when you went into labor again if you were a second-time birthing cat, for example. So, Mother Nature wants us to kind of protect us from that, to give us an overall positive experience of labor and birth, and oxytocin's there to do that, and I had, and many women have had that experience of like, oh my God, birth is it can be painful, it can be stressful, it can be intense, but then afterwards the baby's in your arms and you get this flood of oxytocin and all those receptors are there, and you get even higher levels, even up to 10 times higher in that first hour after the birth, and that kind of washes away a lot of that trauma and the intensity of it. And some studies have shown that when women have had like a physiological birth, down the line, like months or years later, they have better memories of it than women, or their memory of it is softer and softens over time compared to women who had intervention. So oxytocin is beneficial and maybe protective. I would say it could be protective against PTSD and birth trauma as well.
Thank you. That brings me to undisturbed and unmedicated births. So what do you think about them? And if it is possible for women to be able to go through that, is it a better choice when everything else is all right? What are women missing when they do not have that sort of an experience in general?
So I'm going to use the term physiological birth, and we've kind of used the term natural birth, and that's come to mean any time the baby comes out of the vagina. We've used the word normal birth, which has been used in like a technical way for this kind of birth and not this kind. So I'm going to use the term physiological birth. And again, that has been defined as this kind of birth. But the way that I see it is a continuum, right? From a very undisturbed birth with minimal of intervention, and the woman's kind of in her own space and respected and pushes the baby out herself, etc., right through to, like a pre-labor cesarean. And that's the scope of physiological birth. And the more down the physiology end is, the more of these hormones that we're talking about. So as you move further towards interventions, we're going to create what I call hormonal gaps, like things that should have happened that didn't happen. So for example, the stress of labor and birth, the extra pain and the hurrying along, the not readiness with an induction. And further along, I would say, is the epidural, which, as I said, can really interfere with the positive feedback loop of natural oxytocin in labor. And, as I said, in labor cesarean, pre-labor cesarean has the most hormonal impact, the biggest hormonal gaps for the mother and for the baby. So physiological birth, I would say the further along that physiology spectrum you are, the better. Yeah, because the more your hormones are going to flow. And, some of what we talked about is what I call Mother Nature's superb design. It's how we're designed to give birth. And it's not just about labor and birth. It's about from an evolutionary perspective, it's about survival of the species. So all of these things have evolved so that the species survived, right? So we're talking about the oxytocin activating the reward and pleasure centers. That's not just a good feeling. It's not just ecstatic birth. It's actually survival of the species. It's hardwiring that mother to take care of those babies because she's rewarded and motivated. And those things get switched on in those early hours. Probably the first hour is the most consequential after birth. It's called the golden hour. It's when the mother's system is the most sensitive. Yeah. It's when the baby system is the most sensitive. It's when all that bonding and pleasure and reward is meant to kind of kick in and marinate the mother's brain, we could say. So, any time that we're moving further away from physiology, we're risking hormonal gaps at that time. And, I really believe, mothering is a really big job, right? For any mammal, it takes a lot. We've got to put a lot of our own needs aside, whether you're a guinea pig or a cat or an elephant or a human, right? So we need this reward and motivation. Our babies need to be a source of reward and pleasure for us. And that's what it's designed to do, is to make our babies a source of reward and pleasure for us from the moment they're born. So if that's not happening, if there's a hormonal gap, we're risking that might not happen. Yeah. So just to fill in something about that, hormonal gaps, if you are further on that extreme of less physiology, the further along you go, the more hormonal gaps, and you may risk not experiencing some of these things. You may not get that full pleasure and reward. For example, skin to skin contact releases oxytocin. There's lots and lots of benefits for any birth from skin to skin, and particularly in the first hour after birth. And then breastfeeding, I call it Mother Nature's backup system. So skin to skin releases oxytocin, breastfeeding releases oxytocin. Every time we breastfeed, we release oxytocin in that same way. The sensation communications from the nipple, go to the brain, cause a release of oxytocin and pulses, which releases the milk to the baby, the letdown reflex. But at the same time, it's activating all of those reward, pleasure, bonding chemicals and pathways in the brain. So it's reinforcing every time we breastfeed, it's reinforcing. So you can, if you miss out on the physiology, if you have hormonal gaps, if you need a pre-labor cesarean, really skin to skin as soon as possible after the birth for as long as possible. In the wild, there's no limit. There's nowhere else for the baby to be except skin to skin on the mother. We didn't have clothes and hats and bunny rugs and all those things, blankets to wrap the baby in, right? The baby would be skin to skin on the mother. And, it's magical. We call mutual regulation. The baby's regulating the mother's body, the mother's regulating the baby's body. The colder the baby is, the more heat the mother pumps to the baby. The cooler the baby is, the less heat the mother pumps. So skin to skin after birth. And skin to skin after birth, after physiological birth, we know it increases the mother's oxytocin from birth. So from kind of the beginning of labor to the end of labor to that pushing stage, mother's oxytocin levels go up. Well, we say 3 to 4 times. We're probably not capturing the peaks of it. It's hard to take blood samples from women in the pushing stage, right? So we're probably not capturing the peaks. The peaks are probably many times higher. But anyway, in the time if we take 3 to 4 times higher than at the start of labor, then by the time in that first hour after birth, levels can go up even 10 times higher, right? In that first hour after birth from those skin to skin interactions between the mother and the baby. So the baby, especially the baby, the breast crawl where the baby knows how to find the breast and what the first thing the baby usually does is actually to massage the mother's breast with the hand. And that massaging the nipple, that hand massage, that's what causes the mother's oxytocin levels to go up. And then the baby will often suckle the fist. It's like its own fist to kind of get the juices flowing, the salivary juices going, and then the baby will suckle. But it's that first hand massage and that first 30 to 60 minutes after birth where the mother's oxytocin really can go up following physiological labor and birth. It's a different system if you haven't had physiological labor and birth. I can talk about that. But basically, if you have this, any of these hormonal gaps, any of these interventions, skin to skin as early as possible for as long as possible. So that will help to fill in those gaps. And I think just in summary, the benefits of unmedicated, undisturbed birth is that reward and pleasure center activation. You can feel totally euphoric, totally ecstatic, and the baby is part of that positive, we say firing and wiring really is happening in the brain, that positive association that's embedded in the brain in that first hour after birth. Really important, will help you get through some of those more difficult parenting things right up to the teenage years, right? So that's one of the big benefits. And of course, all the benefits for the baby of, the baby being at full readiness, you being at full readiness. Birth tends to happen more smoothly, although it can be slower if we're not pushing it along. It has its own pace and timing, and often slower at times, faster at times. You need to be a bit more patient with natural physiological labor and birth, but it really has its rewards. And also things we don't really understand is how all that functions to prepare mother and baby for breastfeeding. I mean, certainly that hour skin to skin after birth is really important for breastfeeding initiation. Babies that initiate breastfeeding in that first hour, sometimes a little bit longer if the baby's doing the breast crawl. Sometimes they're not quite ready, even after physiological labor and birth. So, that certainly optimizes breastfeeding. But, there must be preparations before the onset of labor to make sure the breasts are ready, for labor and birth, and make sure the baby's ready for suckling. But we don't really understand that so well in humans. So yeah, all that generally an easier time breastfeeding, more pleasure and reward, softening of the brain. You can look back and go, oh, that was a great experience. I'd like to do that again.
You're right. One of my moms was saying yesterday that even though it was a long experience, but she can go through it again, or she'd like to go through again. She's not thinking of a baby, but she's like, oh, the process is addictive. And one of the other moms I remember right after the birth, she said, oh, I can do it again. Oh, it's nice. I can do it again. Which is so different from sometimes the kind of experience I had. I was like, I don't know whether I would want to go through it again at all after I gave birth, which was an unnecessary cesarean and induced, and a lot of other things that happened.
I'm sorry that happened. Yeah, and they, I read a study recently. Actually, was interesting. Like, I think it was a birth trauma study, and the women who had the pre-labor cesarean reported good experiences, but they didn't want to have another baby. So it was interesting. The women had been through physiological labor and birth were more keen to have another baby. And I think that activation of pleasure and reward centers is important, and that's what those women are describing. Oh my God, I feel so good. I want to do it again. When I had my last baby, I really, honestly, my brain just couldn't conceptualize that I had this amazing experience and I had the baby. It's like I'd won lotto, the big raffle twice. It was like, oh my God, how is this even possible? It was like, yeah, so much pleasure, so much reward and pleasure center activation in my brain, I would say. Yeah. And I just want to say one more thing, that the baby gets that as well. So that was one of the findings from our studies, that the baby has these peaks of oxytocin at birth, sampled from the cord blood, which are even higher than the mother's. So the baby's oxytocin is obviously getting ready for labor and birth. They're getting powerfully activated. We think it's through the uterine contractions have like a massage-like effect on the skin. So massaging the skin in a particular way releases oxytocin, but also stress. And I'm saying oxytocin as an anti-stress effect. So sometimes we release oxytocin when we're stressed to counter that stress, right? So we think that the stress of labor stimulates oxytocin release for the baby. So the baby has that reward and pleasure center activation as well, right? So the mother, maximal activation, like ecstatic birth, as I say, the baby's the same and they come together, and I say it's like the best first date ever, right? They're primed to fall in love with each other, and that's important, that the baby is rewarded and motivated to suckle, to be with the mother. The baby will seek out the mother, right? The mother's a source of pleasure. The baby's not aversive to the mother. That would be, death in the wild, right? The baby has to want to be with the mother, has to be rewarded to be with the mother for the species to survive, and my daughter told me that was the best day of her life, the day she was born. So
It is so beautiful to hear that. Wow. And she subconsciously might have that memory of, it's incredible how, yeah, I don't know what to say. It kind of, I had goosebumps when you said that she said it was the best day of her life. I mean,
yeah, she was about 7 or 8, I think, when she told me that. It was kind of an aside comment, like we'd had this really good day and we'd been to the movies and we'd been to the beach and we had fish and chips. And she said, oh, that was the second best day of my life. And I said, what was the best day, Maya? And she said, the day I was born. And babies can remember, if you tune into them. And it's very interesting. Like all of my children have made comments about birth, unsolicited comments. And you can actually have a conversation with your child about it somewhere in all of our brains and our, what's it called? There's a name for that kind of memory. It is recorded in there, our experience of labor and birth. And that's a really good thing to remember, it is encoded in us and in your baby. And it can be a very powerfully healing conversation to have with your child. And I think, my experience with my 2 and 8, maybe 10, they might have a memory and you could ask them, do you remember when you were born? Do you remember anything about it? And one of my friend's babies was born by cesarean and remembered pushing the scissors away to cut her cord. Babies do remember some of these things. Some babies can actually, children can remember people that were in the room and the sound of those people and will recognize their voice, like things you wouldn't think impossible. But children have told those kind of stories and I believe them. Yeah.
kind of also tells us that the imprint of birth is so huge and strong that it stays from. Usually we used to think babies forget and they don't remember anything, but kind of it's different. It's not different, it's opposite. They remember everything and probably might not have a very conscious way of using the vocabulary to say it, but like you said, from your experience, you've seen your babies say it at a younger age.
And you can have that conversation, especially if things didn't go well, like, do you remember anything about when you were born? And they might say something to you and just take it on. And you can say, look, I know this happened. And it can be very, like affirming for the child's experience to have that. And if that's not possible or they don't have memories, another beautiful thing you can do with your child is tell them the story. And even when they're asleep, like go into the room and talk to them all the things that you'd like to say to them. It can be very healing because, when there's traumatic birth, when there's bad experiences, on some level, those things get encoded in us, get encoded in the baby. It can be a source of, well, not exactly conflict, but, like there's something not quite right. And women describe that, there's something not quite right between them. And they go on and have a physiological birth and they describe their relationship as different. And I really believe all of those relationships can be healed and those conversations can be part of that.
Thank you so much. That's really, really powerful, and something that I haven't done, and something I would take as an input from you to do with my daughter, because earlier she used to think she was born, completely undisturbed, and the way I kind of describe it to my parents when she's listening to me speaking to them in the classes. And then very recently she came to know, okay, no, not like that. So I think now that you've also kind of said it, and it's a great input, that I should go back and speak to her now that she has an understanding, and probably, yeah. I mean, it's great to even feel about it. I mean, just to feel that I made an attempt to be able to do that. Yeah, thank you
Beautiful,
so much.
beautiful. Good work, Mama.
Yeah, so kind of we've covered everything we were to, and yeah, I don't think so. There's anything that we didn't cover. We covered breastfeeding, we covered postpartum, and the entire spectrum of labor onto birth and breastfeeding and postpartum. Would you like to add anything to our entire conversation for parents who are probably listening to this as expecting parents, first time parents, not very clear on how to probably have boundaries, be sure of what they want to do? What is it they'd like to have in their experience?
Well, I think the most important decision that you make is what we call model of care, like where you choose to have your baby and who you choose to have your baby with, because that's going to impact your experience. If you choose to have your baby with an obstetrician who has a 75% cesarean rate, you're likely to have a cesarean, right? So you really need to be careful in who you choose, and use your instinct. Like, listen for what we call red flags. They start to say, oh, your baby's a bit big, or I'm going to be away, or things that might be kind of orienting you towards interventions, which generally are more convenient for caregivers. If they induce you, if they do a cesarean, you can fit into their schedule. So that's really important. And if you're going into a hospital, I really encourage you to have your own midwife, if that's possible, or your own doula, or even better, seek out a hospital that has a physiological birth orientation. Yeah, so that's really important. I do say to people also, if we think about this snowball of labor, so labor starts small, becomes bigger and bigger, and becomes virtually unstoppable. That whole process is generally slower with a first time mother, because you haven't been through this before. Like, you've never done it. Your body hasn't done it. Those neurons haven't connected to each other in the same way before, right? So it's easier to get your labor disrupted as a first time mama, and especially to get sped up because you tend to go more slowly. And there's something that happens when you move from home to hospital, is that and we're talking about evolution and designed to giving birth in the wild. Well, a laboring female of any species is very sensitive to her environment. Like, she needs to know she's in a safe place to give birth, right? And if there's strange people, strange smells, strange noises, clanging noises, beeping machines, that tends to make us feel unsafe at this very deep primal level. So moving to hospital is often a risk for the processes of labor and birth. Like, many women find their labor slows down or even stops. That's when we're having a supportive birth companion, a midwife, or a doula can help you to get over that. But another way around that, which is slightly tricky but possible, is to labor at home as long as you can, and again, ideally with a companion at home, and then move to hospital at that end of the labor when your snowball is so big it's not going to get disrupted by moving into hospital. And in fact, at the end of labor, a little bit of stress can sometimes bring on labor. So women sometimes describe they got in the doors of the hospital and had the baby, or they got into the room and had the baby 10 minutes later. Often that happens because they've got to that stage of labor where stress accelerates labor. And again, in the wild, if a predator turns up at the end of labor, you can't really stop it, but it's safer to give birth quickly and then run away. So that's kind of the physiology behind it. So that's another way of doing it. But of course, you probably want some support at home, or at least have someone on the phone to know when to move into hospital, that kind of thing. So those are the things I'd suggest for especially first time parents giving birth. And the second thing I want to say, and this is more to people that have already given birth or had not an ideal time and are listening to this going, oh dear, you can fill in those hormonal gaps, as I said. So, you can talk to your child on that level, but also after the birth, breastfeeding, as I mentioned, is Mother Nature's backup system. Every time you breastfeed, you're releasing all these hormones, and you are filling in those hormonal gaps. And the other thing is skin-to-skin contact. And, in the wild, as I said, there's nowhere else for the baby to be but skin-to-skin on the mother. And there was one study, for example, that randomized women to skin-to-skin with their baby. I think it was like 4 hours a day the first week and then like 2 hours a day for the first month. And those mothers had lower postpartum depression scores. So your baby is your medicine. So skin to skin increases your oxytocin, your prolactin, all of those feel-good hormones, makes you feel good, makes your baby feel good. The baby knows that's where they're meant to be. So that's a beautiful way to facilitate not just breastfeeding but your whole postpartum experience. And there's like soft carries you could use, simple things you can strap your baby in. It's something they're using a lot in NICUs and for preterm babies, because we know how much better it is. Babies grow better, they thrive, they have better oxytocin levels, they feed better, and that's all true for full-term babies as well. So yeah, it's never too late to fill in hormonal gaps, and give yourself the best chance of physiological birth by being savvy about where you choose to have your baby and who you choose to have with you. Oh, one more thing. Just in terms of that environment, choosing who to have with you, like you are the queen of that environment, right? Anna Mae Gaskin, the American midwife, said, if a woman doesn't look like a goddess in labor, people aren't treating her right? You should be the center. It's what you say that counts. And you also need to have that ability to have people that you want there and not have people there, so tell people, I might call you or I might not call you. You can come in, but I might ask you to go out. You don't want people in your birth space that you're going to feel uncomfortable with. Like birth is such a primal experience. It's a little bit like sex. The hormones are the same as sex, right? And you want an intimate space where you feel safe. So that's really important when you decide who you're going to have there with you. Make it flexible. Yeah, you might just want you by yourself, you and your partner, you and your midwife, you and your doula. You might be in the toilet or in the shower with nobody there. You don't know how it's going to be, right? So make yourself a flexible arrangement so that you can really be in the experience. Yeah, because it is an extraordinary experience. Yeah.
Thank you so much, Dr. Sara. To me, this is like a full circle, there is so much completeness, and there's so much, how do I say it? Love, compassion, and all of the things that women need to hear. So thank you so much for taking us through and through to the entire aspect of mind, body, connection, and labor and birth, and also what we can do if we didn't have the kind of birth we imagined, which is so useful. Yeah, thank you so much. I'm so grateful.
My pleasure. Yeah, just sending much love and blessings to everyone on that journey.
Thank you. There is a field beyond fear, where the body is empowered to take on labor and birth. To land there, it is crucial to take birth education. To enroll into our unique labor and birth preparation course, reach out to us at www.birthagni.com or scroll through all available prenatal and postnatal preparation classes. Thank you for listening, all in the spirit of birth, womanhood, and freedom. Remember, you got the power. This podcast is about physiological birth and does not offer or claim to provide medical knowledge or diagnosis. Starting a podcast with poor recording tools in the market? It was painful until I found Zencastr. Its high-quality audio and video recording along with the option of a backup makes it super sturdy and a savior at times. With an easy-to-use dashboard and super convenient tools for advertising campaigns such as reels and videos, Zencastr is my comfort choice. Go to zencastr.com/pricing and use my code BIRTHAGNI, BIRTHAGNI, and you will get 30% off of your first month of any Zencastr paid plan. I want you to have the same easy experiences I do for all my podcasting and content needs. You may also explore their free hobbyist plan to begin with.